Good morning, and welcome to the Transportation Disadvantage Coordinating Board meeting, February 26, 2021. I hereby call the meeting to order, and we are currently establishing a quorum, and so in the interim, we're going to start with our status reports on section 5 of your agenda. Starting with the Hillsborough Community Health Assessment.
Hi, good morning, everyone. This is Griselle Cisneros from the Department of Health, and I just wanted to present to you all. I don't know if I have access as a presenter to go through the slides.
Yes, we're seeing your slides. Thank you.
Okay. Now I'm
let me know
sure.
when you want to move slides, and
Okay.
I'll just if that
That's
works.
easier. That's perfectly fine. Okay, well, good morning, everyone. I'm just briefly going to present to you the Community Health Assessment and Community Health Improvement Plan documents that are available for your use from the Florida Department of Health in Hillsborough County. Next slide, please. These are two documents that are created after a 3 to 5 year cycle. They are developed to identify the priority needs in community health, and they are guided by a model called the Mobilizing for Action through Planning and Partnership. The main focus of this is to involve community partners and stakeholders and to have a comprehensive process that allows for the input of many partners. Next slide, please. Our assessment is composed of both primary and secondary data. I'm going to talk a bit about the primary data that was collected for the current document, which is the 2020 edition of the Community Health Assessment. We ran about 5,000 surveys and 25 key informants were interviewed. These are people who are leaders at local hospitals, local healthcare systems. We also had 4 focus groups with about 40 people that were conducted both in English and Spanish. We have that survey available. It's about a 75-item survey, so it's quite long, but it would be available for any of you if you're interested in looking at what questions were asked. Next slide, please. The secondary data comes from a number of sources that are all available publicly, including Florida Charts, the Census, Robert Wood Johnson Foundation, and these are data figures on everything from chronic illness to access to health care, morbidity, mortality, anything like that. Next slide, please. The third component was a meeting, a prioritization exercise that occurred on July 24th of 2019. At this point, the survey results were presented and the secondary data was presented, and people identified the priority areas. Next slide, please. The top 10 health problems in Hillsborough County were deemed as being, the top 3 were behavioral health, access to health services, and the third one, exercise, nutrition, and weight. This is the full list of the top 10. For our health improvement plan, we focused on the top 3. Next slide, please. So one way that this assessment, this community assessment, may be relevant to your group is the fact that we are able to identify high-need zip codes. Because we collect data, when we collect data, we ask the zip code. We also ask things like income, annual income, and other things. We can sort this data and identify those zip codes that are considered high need. So on your screen, you're seeing 7 zip codes that are considered the highest need in Hillsborough County. Next slide, please. These are some figures from these high need zip codes. The first one is public transportation easy to get to if I need it? And you can see the percentage of people who answered yes. So for planning purposes, you would focus on those zip codes that have the lowest, such as 33614, where only 40% of people said yes, it's easy to access public transportation. Next slide, please. This was another question I picked, the good sidewalks for walking safely. Again, looking at those 7 zip codes that we identified earlier, 33604, only 33% found that there were good sidewalks in their neighborhood. Next slide, please. Food insecurity. This is something I included because I know it's a huge thing right now, and it also brings about the need of people to move and go find places to shop for food, or perhaps get a food bag or things like that. So these are the highest need zip codes: 33617, only 44. I'm sorry, this is food insecurity. So 33619 is experiencing the highest food insecurity. Next slide, please. So what happens next? This is an ongoing cycle with the CHA and the CHIP, the Community Health Assessment and Improvement Plan. We are always reviewing it. In fact, right now we are in the process of putting together an updated progress report that will be posted on our website. It's going to include, obviously, everything that happened last year, including COVID and all the changes that has brought. So we create an inventory of all the assets and programs that are available, and we continue the process of action planning, which is meeting with our steering committee and identifying any areas that might have changed, and monitoring the progress of our health improvement plan. Are we making progress in the activities that we said we were going to accomplish? Next slide, please. Finally, I wanted to show you where these documents are found. They are on our website at this URL. You can also request hard copies from me. I will be more than happy to send them to you. They are easy to read, available to anyone. They guide people in putting together grant proposals, in just gaining enough information about the county. Again, we have the main document, and we will also have the progress reports around March or April of this year. Any questions, anyone?
We don't have a hand raising function on this. So I think if we're polite and careful about piping up, if anybody did have a question, to try to go one at a time. Any discussion?
Yes, good morning. This is Artie Fryer.
Hi, you're recognized, Mr. Fryer.
Yes, thank you. I see the web information, but is your information, your personal information to contact you included there, or can we get that?
Sure, absolutely. I will go ahead and in our chat box for this meeting, I'll put my email, and you can email me there to request hard copies, to request the URL, anything else. We also have electronic versions of the documents in the PDF form, so I can also send that. So I'm going to switch over to my other screen since I have a bunch of screens here, and you will see my email pop up in the chat box. And I'm more than happy to receive any questions or any requests for documents.
Wonderful, thank you.
Thank you.
Right. And I do have the chat box open. I have kind of keeping my eye on that, and Mr. Barber can help me if anybody during this presentations or discussions needs to indicate that they want to be recognized for one thing or another. That's another option. Any other questions or discussion? Seeing none, Ms. Cisneros, thank you very much. This is a great presentation, just the way I like them, meaty, plenty of information, and concise.
Wonderful. Thank you, everyone, for your time, and feel free to send over any questions. I'm always available.
Thank you. It was very eye-opening, a little heartbreaking, some of those statistics, but gives us a good context for our work. Thank you very much.
Absolutely. Thank you.
Mr. Barber, do we have a quorum yet?
We do.
All right. Let's get to back to the top of the agenda and take a roll call.
Okay, Commissioner Smith,
Here.
Gloria Mills,
Gloria's here.
Craig Fursell, Councilman Schisler, Tracy Knowes,
Here.
Cassandra Blaylock, is Cassandra here? She's an in-person.
Mm-hmm. Yeah, she's here.
Okay. Deborah Knoll,
She's here as well.
Christina Melling,
Here.
Mark Harshbarger. He's present
He's present, yeah.
in person. Nancy Castellano. Dr. Leslie Gordon. Glenn Brown.
I'm here.
Don Pelkey. Nancy Pacifico. Emily Hugart.
Present virtually.
Jody Toner.
Present virtually.
Artie Fryer.
Present.
Beth Pasek.
I'm here.
Okay, we do have our 5 in-person quorum.
Okay, and I didn't hear the people that are in person, so I'll ask Mr. Barber to just make sure that if people are in person raising their hand or something, that I don't miss that if somebody wants to speak.
Yeah, I will. And I'll go around the room real quick and make sure everyone can unmute themselves. So just give me a moment.
Okay, all right. Next item of business is public comment. Do we have any public comment? People present for comment at the beginning?
I don't see any public comment.
Okay, thank you. And next is the approval of the minutes from the October 23rd meeting and December 11 meeting. Do I have a motion to approve both of them?
I'll move
So
to
moved.
approve. There we go.
Okay,
And
I heard
Artie Fryer seconds.
a motion to approve. Who made the motion to approve?
You can pick either me, Glenn Brown, or Artie, and
Okay,
I'll either take a second or an move to approve. I'm not picky.
let's say Mr. Brown made the motion to approve and Mr. Fryer made the second.
All right.
Do we need, let's take a roll call vote.
Commissioner Smith,
Yes.
Gloria Mills, I can't hear Gloria.
says yes. 1 second.
Tracy Knowes,
Here.
Cassandra Blaylock,
Yes.
Deborah Knoll, Christina Melling,
Yes.
Mark Harshbarger, Glenn Brown,
Yes.
Emily Hugart,
Yes.
Jody Toner,
Yes.
Artie Fryer,
Yes.
Beth Pasek.
Yes.
Motion carries 10-0.
Thank you. All right, our next, moving on to the action items, we have election of officers, and Mr. Barber is going to lead this item.
Are we on election of officers now?
Yes, sir. Thank you.
Sorry, I'm running around the room trying to get everyone set up here.
You're very busy.
I know. Okay. All right. Thank you all. So we're going to do a quick election of officers this morning. The MPO bylaws require us to do this every year. And some important things to know is there are no term limits for officers, and they can be reelected and serve indefinitely. So we need to elect, of course, Commissioner Smith, you are appointed by the MPO board as our chair, as an elected official, but we do need to have officers for vice chair and member at large. These responsibilities are primarily if Commissioner Smith is unable to chair the meeting, then the vice chair or the member at large would chair the meeting. So we will take nominations. You could nominate yourselves or any other person. No second is needed. And we will vote on each nomination individually until one member receives a majority of the votes for an officer's position. So the current chairs or current officers are Vice Chair is Gloria Mills. She has been for a very long time, I believe, and our member at large, I believe, is I actually don't think it's John Pelkey, so I apologize about that. But we will elect a new one. So I will take nominations for Vice Chair first.
Well, let me ask a question. Is Ms. Mills willing to serve again as vice chair?
End question.
Yes.
Mm-hmm. Did you hear Ms. Mills?
Yes.
Yeah.
So I'll nominate Ms. Mills for vice chair.
Any other nominations?
I'm going to nominate Mr. Mark Hirschberg.
All right. Any other nominations?
Well, no. Okay.
No. So we're going to vote on them in order of which they were nominated, and whoever receives a majority first will assume that role.
May I ask a question?
Yes, ma'am.
Ms. Mills, I understand you're willing to serve again if elected, but because you nominated Mr. Harshbarger, does that mean you prefer to step down and have somebody else take over vice chair?
I'm hoping you can hear me.
Yes.
What I think it makes it more interesting to have a vote, and to me, I'm glad to serve, but I would, you know, if somebody else steps up, it's fine with me. It's just good to vote.
Okay, thank you. And with
So
that, we'll go ahead and take a vote. Yeah.
yeah, we'll go ahead and take a vote for Gloria as vice chair, if we could call the roll.
Commissioner Smith,
No?
Gloria Mills,
Yes.
Tracy Knowes,
Yes.
Cassandra Blaylock, did Cassandra respond? I can't hear her.
Is that a yes, Cassandra? Yeah, that was a yes.
Deborah Knoll? Yes. Christina Melling?
Yes.
Mark Harshbarger? I cannot hear him either. Is it yes?
That's a yes.
Glenn Brown?
I have to vote yes for the fan of democracy.
Emily Hugart?
Yes.
Jody Toner?
Yes.
Artie Fryer?
Yes.
And Beth Pasek?
Yes.
11 to 1 for Gloria Mills.
All right. Well, Gloria is vice chair then. Again, congratulations.
And let me say congratulations, Ms. Mills. I was trying to guess what your wishes were there in voting for the person that you nominated, but I am delighted and grateful that you are willing to serve again and elected as our vice chair.
Thank you.
And so we will go on to the nominations for the member at large. Any nominations?
Artie, do you have any interest?
Uh, actually, no.
Well, okay.
Mr. Brown, would you be willing to serve as a third in case to run a meeting in case both the chair and the vice chair are absent one day?
My fear is that I'm unreliable due to my position at the Children's Board is my fear. I mean, I have done it in the past a while ago. We can throw Mr. Harshberger up there again if he's willing.
He looks willing to me.
Okay. Let's call that a nomination from Mr. Brown for Mr. Harshberger for our member at large.
Cheryl?
Commissioner Smith,
Yes.
Gloria Mills,
Mr. Smith,
Tracy Nose,
Yes.
Cassandra Blaylock,
Yes.
Deborah Knoll, Christina Melling,
Yes.
Mark Harshberger,
That was a yes.
Glenn Brown,
Yes.
Emily Hugart,
Yes.
Jody Toner,
Yes.
Artie Fryer,
Yes.
and Beth Pasek.
Yes.
Motion carries 12-0.
All right.
Great.
Well, thank you. Thank you, Mark.
Great. So congratulations to our new vice chair and member at large, and thanks for being willing to serve. That takes us to item B, the evaluation of our Community Transportation Coordinator, CTC. Mr. Barber, you're recognized.
Thank you, Commissioner. So we all kind of sat through this presentation back in December. So I'll make this one quick. This is an overview of our CTC evaluation for the last fiscal year ending June of 2020. The evaluation is a required product by the state, and it's conducted annually, except for the year of the CTC designation, which was this year. But we decided to go ahead and conduct one anyway to evaluate the impacts of COVID-19 on operations and service quality. So the components of the CTC evaluation include an overview of our TD program, what services we have in the county. We also took a look at impact of COVID on the Sunshine Line system, their response, and what initiatives they had to continue to provide service to our TD population in the county. We have a performance evaluation component that ties back to our TDSP that looks at areas of reliability, effectiveness, efficiency, availability, safety, as well as complaints. And then we also conduct a customer survey every year of both the door-to-door customers on the Sunshine Line, as well as customers that receive a bus pass for HART. We also provide recommendations for the CTC moving forward. And this year we did a 5-year review of the CTC to support the redesignation coming up. So some overview of the impacts of the pandemic on our TD services. We saw a significant drop in door-to-door trips from aging services sites, which closed in March. A suspension of group trips, and so an overall decline in the number of users in the system. But the Sunshine Line was still considered an essential service, and they were and still are providing trips for medical, food, employment, and other needs. The Sunshine Line responded to the pandemic internally by moving to a remote work system. They improved their training and safety measures, including sanitation and PPE. They provided PPE for the drivers as well. The number of riders per trip were limited from 1 at first and then moved to 3. And I believe they're allowing some more folks on rides now. And they also had employee screening measures put in place, such as temperature checks and other safety measures to ensure safety. They've also continued to provide community services during COVID. They were doing meal delivery for aging services sites 4 days a week, providing transportation for quarantined and isolated clients. They provided additional training for drivers, alternating the days of their driving, and to date, they haven't had any service-related cases among riders or employees. And they are also providing transportation to vaccination sites as well now. So the service evaluation looked at these major areas of on-time performance, travel time, road calls, as well as trips per capita, costs, vehicle availability. And they met, the CTC met all service standards except for the number of trips provided per capita. You can see the service standard for that is greater than a half a trip per capita annually, and they hit at 0.45 trips. So just under the standard, but this is definitely a result of the impacts of COVID on the overall system. But otherwise, all service standards were met for this year. So I'll go over a little bit what the door-to-door customer survey showed us. We send out a survey every year to the customers, evaluating their impression of the service. And so these are some highlights. We had almost 160 surveys returned. The service reliability, the phone calls were answered more promptly. We saw an increase in satisfaction with that, increase in satisfaction with the automated phone systems for the door-to-door customers, and 99% of people who took the survey said they feel safe riding during the pandemic. And to the right is kind of an overview of the socio-demographic, economic characteristics of the survey respondents. So 65% were female, 15% use the service over 10 times a month, 78% of clients use it for medical service, and 14% of the respondents have Spanish as their preferred language, which was a new question we asked this year. And just continued, we asked a few more questions to kind of evaluate regional needs. So we asked if the client or the family would go to Pasco or Pinellas County, transportation for stuff like medical and shopping. 51% said no, but 49% said they would use the service for a cross-county trip. And 94% of respondents said they prefer to make reservations by phone. And the map on the right is the number of respondents by zip code. So you can see it's primarily outside of the heart service area. We also did a bus pass customer survey. We had almost 600 surveys returned. And some highlights, satisfaction in the vehicle's condition went up 3%, satisfaction in how complaints were handled went up 3%, but only 84% of bus pass customers felt safe riding during the pandemic. And on the right, we also have kind of an overview of rider characteristics as well. And just kind of moving on. We asked this new question this year on how people usually get to the bus stop. 78% said they walk, 8% use a mobility device, 3% bicycle. And then you can see on the right, the number of respondents by zip code is primarily within heart service area. Some service recommendations we made this year are to maintain current service standards and levels, continue to respond to the pandemic in innovative ways that serve the community, and then, looking towards the end of this, hopefully restoring service to baseline levels after the pandemic ends. And some 5-year highlights, within our designation year, we had the number of road calls per 100,000 vehicle miles traveled drop significantly from 2016 to 2020, from 17.9 to 5.43, which is really great. It shows our responsiveness to concerns as well as responsiveness to service standards. We've had more vehicles become available for TD trips. The CTC has consistently met all the service standards. And really, they have had a great response to the pandemic and continuing to serve the community. So with that, this is old from last year, I apologize, but I would like to request a motion to adopt the Ctc evaluation and forward it on to the Commission for the Transportation Disadvantaged.
Thank you. Is there any discussion, questions, or comments about the presentation?
Actually, I do have kind of a question, but you may not be able to answer, Joshua. You had the interesting question of how safe people felt, and I thought the 84% was pretty darn reasonable. But I also wondered what is our feeling of safety in the county in general during the pandemic. I mean, how many of us have felt safe overall? And I think that'd be an interesting, contrast to have it there. So I suspect they might be feeling safer riding that bus than they felt going shopping or just being, alive at this moment. So just a thought.
I agree.
Right, that's a good point. Who feels safe these days in the middle of a pandemic? So just keeping that context in mind. I think that it's another great report with a lot of really good information, very well presented, so we can understand the big picture. The question that popped out in my mind when we're talking about cross-county sort of regional transit for people is transportation. Was the question, would you use this if you had to go to Pasco County, or are you using this to go to other counties?
The question was, would you use this?
Do we have a sense of, what is the sense of people that are using it to go in and out of outside our county?
I don't know if Karen would best be able to speak to that if she's online.
Yeah, can you hear me now?
Yes.
Okay. Well, I think the question was in the door-to-door survey, and we don't currently take we take like a case by case. We'll take a trip out of county if it makes sense to. So I think that question, if you were currently using it, would really be more for people in the bus pass, because you can currently take transit between counties. So I think that's why it was worded that way. It was for door to door, and we don't take very many people across county lines. So the question was, I think, more in trying to see, do we need to be doing more of that? Maybe we do from the response.
They would take it if they had to go, but do they have to go? I mean, I know that a very high percentage of car trips in our county are start and end in Hillsborough County. And so there is not as much need for going cross county as is sometimes represented by in different venues that I'm in. So I was just, really wanting to kind of understand how much of this is really needed in this population.
Yeah, I think so. I think we find that it tends to be a preference rather than a need if you're from Hillsborough County. I think people from other counties may need to come into Hillsborough County, but it isn't
Right.
necessarily true. Yeah, I would agree.
Thank you.
People live in Hillsborough. Yeah.
Thank you. Any other questions or discussion?
Hi, this is Beth Pasick. I do have one question on the, I noticed the surveys came back at about 160 and 660 for the two different areas. Is there a way to increase the amount of surveys, or about what percentage are we getting surveys returned? It seems like that's fairly low on getting actual surveys back.
Yeah, it is a little low, and it's kind of par for the course. I can't recall the exact percentage of respondents. I know that the bus pass survey, the list of people we send it out to is much larger than the door-to-door. So that's why we got a significant amount more of bus pass surveys back. But I could get back to you on what the actual percentage breakdown was after this.
Okay. Any other questions? Any hands raised in the room? Nope. All right. Seeing none, thank you very much for this presentation. And at this point, I guess we have action to take, Mr. Barber.
Yes, I would like a motion to adopt the Ctc evaluation and transmit it to the Commission for the Transportation Disadvantaged, please.
So moved, Glenn.
We've got a motion. Do I have a second?
Second.
Great. I've got a motion by Mr. Brown, second by Ms. Mills to adopt the Ctc evaluation and transmit it. We'll have a roll call vote.
Commissioner Smith,
Yes.
Gloria Mills,
Yes.
Tracy Knows,
Yes.
Cassandra Blaylock,
Yes.
Deborah Knoll,
That was a yes.
Christina Melling,
Yes.
Mark Harshberger, was that a yes? Glenn Brown,
Yes. Yes.
Emily Hugart,
Yes.
Jody Toner,
Yes.
Artie Fryer,
Yes.
Beth Pasick.
Yes.
Motion carries 12-0.
Thank you. We are getting a little feedback, so if everybody would try to mute their devices while whenever you're not speaking, that might help it. So we'll go to the next item, and that is the Ctc designation. Mr. Barber, you want to walk us through that?
Yeah, I'd be happy to. Thank you, Commissioner. Good morning again. So every 5 years, our board and the MPO are tasked by Florida Statute Chapter 41.2 to review the designation of the Community Transportation Coordinator and ultimately to recommend a CTC to the Florida Commission for the Transportation Disadvantaged. The last CTC designation for Hillsborough County was in June of 2016, and our next designation is due for renewal in June of 2021, so here in a few months. As you all know, the purpose of our TD system is to ensure the availability of efficient, cost-effective, quality transportation services for our TD persons in the county. And the role of the CTC is to coordinate the provision of those cost-effective, efficient, and unduplicated, unfragmented transportation disadvantaged services with all of our local service providers within the county. The Hillsborough County Board of County Commissioners has acted as the CTC for Hillsborough County since 1990, and Sunshine Line has been operating that services for the county since then. And so over the past 5 years, the CTC, the Sunshine Line, has continued to meet nearly all of our service standards set forth in the Transportation Disadvantaged Service Plan. They have provided reliable, effective, and efficient services to RTD clients. And the number, for example, the number of road calls has been significantly reduced through efforts by the CTC, showing a responsiveness to community needs and board concerns. And as you saw in our last evaluation, they have continued to meet all of our service standards for the most part. The customer service survey that we conduct every year shows an overall satisfaction with the service from Sunshine Line clients for 99% of them. And the CTC has continued to respond effectively and safely to the pandemic and finding innovative ways to serve our community. We should all really be proud of the work the CTC has done and continues to do. They have provided a letter from the county administrator expressing their willingness to continue to serve as the CTC. And so I'm happy to recommend and request that this board support the redesignation of the Hillsborough Board of County Commissioners and their operator, the Sunshine Line, as our community transportation coordinator, and that we forward this recommendation onto the MPO board and the Commission for the Transportation Disadvantaged.
Thank you. So we'll be looking for a motion for that, but I do have to say, I do think we have a lot to be proud of there with our Sunshine Line and our community transportation coordination in Hillsborough County. So with that, is there any, do we have a motion?
So
Gloria
moved.
Mills?
This is Artie Fryer.
I've got a motion by Mr. Fryer and a second by Ms. Mills, I think, to
That's correct.
yes, to recommend the MPO approve the redesignation of the BOCC as the CTC and Sunshine Line as the operator and forward that recommendation. Let's take a roll call vote.
Commissioner Smith,
Yes.
Gloria Mills,
Yes.
Tracy Knows,
Yes. Yes.
Cassandra Blaylock,
Yes.
Deborah Knoll, yes. Christina Melling,
Yes.
Mark Harshberger, Glenn Brown,
Yes.
Emily Hugart, Jody Toner,
Yes.
Artie Fryer, Beth Pasek,
Yes.
motion carries 10-0.
Thank you, everybody.
Great. We are getting some good work done today. And we'll move to the next item of business, to the coordination contract with Life Concepts presented by Karen Smith from the Sunshine Line. Ms. Smith, you're recognized.
Good morning. As most of you know, although it's been a little while since we've had one come to the board, we have coordination contracts with agencies that generally provide service for their own clients, but are recipients of 5310 funding through DOT. And as part of the requirements for that funding, they are required to have a coordination contract with the CTC. It passes on some state requirements. Most requirements are already included in the grant requirements, but it passes on some requirements and requires them to report to the CTC so that their information is included in the AOR and the annual operations report that you see each year. Life Concepts with DBA Quest currently has an agreement and is applying for additional, and has 5310 funded vehicles and is applying for additional vehicles. Their contract has just expired. We would have brought this in December, but we didn't have a quorum, so that's why it's coming today. So we need to enter into a new contract for them to meet their requirement for that grant. They provide funding for their clients who have disabilities and who either live in one of their facilities or attend their day programs. Obviously, they're also one of the programs whose trips have been reduced since COVID. But for the last reporting cycle, they provided almost 21,000 trips for their 84, 85 clients. They have 20 vehicles. Their cost per trip last year was $110 per trip, but that was quite heavily impacted by the reduction in trips, from March or so on with COVID. That is not typically their cost per trip. It's closer to probably 2/3 of that when I went back and started looking at previous years. But we need approval from this board to enter into a new agreement with this agency. And then it will go on to the Board of County Commissioners in March.
Thank you. And thank you for putting that cost per trip in context. Just like so much we were reviewing today, we have to keep in mind that this is a very unusual year and unusual figures and averages that we're looking at. I appreciate your pointing that out, and so we have a full understanding. So if there's, at this point, we're looking for a motion to approve the coordination contract with Life Concepts.
I have a quick question for Karen. Thank you. Karen, I just want to hear directly that you guys, as the coordinating body, Sunshine Line, feel that this group meets your standards and you're okay with them providing this service under contract with you. I need to know that that's okay.
Oh, yes, absolutely. We would, and we would. I'll say that explicitly, but we wouldn't be bringing it back if that were not the case. And normally, I'd also check with DOT to make sure they don't have pending issues with their grant cycle before we even start to do a new contract, so that we know they don't have issues with them as well.
Thank you, Karen.
Great. It's good to get that on the record. Thank you, Mr. Brown. Any other questions for Ms. Smith or discussion, comments? Seeing none, do we have a motion to approve the coordination contract?
Glenn will move.
Second.
Got a motion by Mr. Brown, second by Ms. Mills, was it?
Yes.
Okay, let's take a roll call vote.
Commissioner Smith,
Yes.
Gloria Mills,
Yes.
Tracy Nose,
Yes.
Cassandra Blaylock,
Yes.
Deborah Knoll,
Yes.
Christina Melling,
Yes.
Mark Harshbarger, Glenn Brown,
Yes.
Emily Hugart,
Yes.
Jody Toner,
Yes.
Artie Fryer,
Yes.
Beth Pasek.
Yes.
Motion carries 12-0.
I'm sorry. So that takes us to the next item, E, on our action items. We've got to appoint a subcommittee for the Transportation Disadvantaged Service Plan. Mr. Barber, you want to explain that for us?
Yeah, I'd be happy to. Thank you, everybody. I brought to the board a few months ago an overview of our Transportation Disadvantaged Service Plan development process. As you all know, we'll be doing a minor update, which will be coming to the board in June, and then a major update that will coincide with the redesignation of our CTC will be coming in October. So one of the big things that we would like to tackle as part of our major plan development is the development of goals, objectives, strategies, and policies for the CTC. And that's going to be one of our big internal tasks. our consultant is going to be handling a lot of other stuff, but I wanted to work together with the board, with the CTC, in developing these goals and objectives. So I'm hoping to get 1 or 2 members that would be willing to participate over the phone with me, with the Sunshine Line, perhaps with our consultant in developing those. I don't foresee it being more than let's say 3 or so 1-hour meetings over the next 3 or 4 months. So if anyone would like to nominate themselves or another member, please feel free. And we don't need to take a vote on it or anything like that.
Mm-hmm.
Well, it sounds reasonable, Joshua. I hope you're right. I'll volunteer.
Thank you.
Thank you so much.
That's one. Do we have any more volunteers?
This is Christina Melling. I'll also volunteer.
Awesome.
Thank you both. I appreciate it. I will get with you all when we're ready to kind of get started and give you all a bit of a background and where we're at. So thank you so much.
Mr. Barber, who is the consultant on that project?
That is Tyndale Oliver. They'll be doing our public involvement and public outreach, some demographic work, and some other stuff. And on our end, at the staff level, we'll be developing the goals and objectives. We'll be getting the service standards in other areas from the Sunshine Line. So I'm really looking forward to it being a nice collaborative effort.
Mm-hmm. I would just ask the members of this committee and the staff to be diligent in your review. We've had varying levels of information presented by various consultants. So just make sure we're counting on you to vet the data that and findings of the consultants. Thank you.
Thank you.
Commissioner.
So next item, well, that takes us through the action items, and we have one more status report left, the Sunshine Line update by Scott Clark with Sunshine Line. Mr. Clark, you're recognized.
Hi, good morning. I'm Scott Clark today.
Thank you.
Yeah, Scott's off today. So just
Okay.
a couple of things to update the board. Josh did mention that we've had, and when I think in the Ctc evaluation, we've had a reduction in trips. Just as an update, we're now doing about 40% of the volume that we did last year for door-to-door trips, but we actually went back and looked at it in the last week to see, okay, what if we looked at last year without aging services and without the group trips? And when we take that out of the picture, we're actually doing a little bit more of those single trips than we were doing last year. So based on that, we're assuming that as soon as aging services reopens and we can start doing larger group trips, that we will be at the very least back to where we were a year ago and possibly more service than we were doing a year ago. So it was actually a good exercise as a comparison to see, you know, had all the other trips dropped off or not. It's really just that those groups have dropped off. And we do provide single trips for some of those people who were taking group trips. It's just, I think less of those people are going out at all. And just as an update, we just finished a couple weeks ago, I think, installing extra air filtration systems in all of the vehicles that will be funded through, I think it's CARES Act funding, but it's federal funding. So we added, it's air filtration for each of the vehicles that works through the air conditioning system. So it will filter the air and make it much safer for all of our riders. Ongoing, we're hoping to test out some kind of passenger barrier things in the vehicles that will let us hopefully put some more people in the vehicles at a time. So hopefully that will be coming soon. And as Josh also mentioned, we are providing transportation for vaccines. We're doing through emergency management to the state and county run sites, but we'll also take anyone who's transportation disadvantaged if they're going to CVS or Walmart or wherever it is that they're going to get their vaccine, we're taking people to get their vaccines also. At the larger sites, they kind of work with us where they're those drive-through and you have to sit in the vehicle and wait. So they either designate a spot for our vehicles to wait, or they, so that we're not in the line for for an hour if it's taking that long, so that our clients can get to where they need to go and we can get on to the next trips. We recently hired we finally hired the new paratransit manager position. She is in training this week, so we would have introduced her. So I would assume at the next meeting you will meet her, and she'll have been trained and indoctrinated into our program, and but you'll meet her at the next meeting. She comes with a lot of logistics experience, so that should be good for us. And we've had that position vacant for several months. So, and I think that is it. If anyone has a question.
Any questions, comments?
Hey, Karen, I had a question actually.
Yes.
You're recognized, Mr. Barber.
Thank you. I had gotten an email from Dr. Gordon earlier this week, and she was wondering if we've had any anecdotal evidence of any kind of transportation barriers for people getting vaccines. And I'm wondering if you've heard anything about that, and I guess to the rest of the board, if there's been anything within your programs that indicate that.
The only thing that I know of is there was some, and I'm not even sure how it ended up in the end, and now they're moving that site, but there was some question about whether they would take walk-ups, because there are, when at, say, University Mall, I mean, it would be much easier for everyone involved for a person to be able to ride transit, walk up, have a waiting area, and I think that kind of went back and forth whether they would accept walk-ups. So accepting walk-ups at the larger vaccine sites would help people who don't have a car. They're riding transit and they can ride transit to the site. That helps everyone. They have greater access, and that was the only issue that I think we've seen. Is that.
Thank you.
Thank you. Yes, I from my office had worked with a citizen who had that issue of walking up or even coming up on a scooter, I think, of some kind. But when we chased that down, there were at first some staff that was misinformed, I think, at the State Department of Health, and they since worked it out, as far as I know, that they do accept walk-ups, and they have, as you describe, a waiting area, socially distanced, and they can bring the vaccine to them there. But it is certainly worth confirming and double checking that still is working smoothly, because it is a problem for all kinds of populations, from homeless to people riding transit.
I did see that in the map for the where they're moving the site over to by Raymond James, that I saw the walk-up area designated on that site plan. So at least there, that should be not an issue.
And I just noticed last week in the Tampa Bay partnership does a state of the region, is maintaining a state of the region report and dashboards, that they are calculating mobility for the Tampa Bay area, and it dropped down below 40%. I'm talking about traffic, I imagine, on the roads. It is back up to, I think, 75% of our average, our usual. So that's, you might look at that and see if I'm remembering that correctly. It's at stateoftheregion.com, but that also would provide some background data to compare, how much mobility the whole region is having in the regular people leaving their homes, actually getting out of their houses and going to work, and has been restricted. So to see how much of that is back and when would be interesting as we compare the disadvantaged population. Mr. Brown, you're recognized.
Thank you. Joshua and Karen, if that does interest you, it is Dave Sobush is in charge of kind of organizing and putting that data out. And I can put you in contact with him if you would like to do so.
Yeah, that would be great, Mr. Brown. Thank you.
Just thinking it's kind of baseline what the mobility is for everyone in the region during the pandemic to compare. Any other questions or comments about the presentation? Seeing none, that's about to take us to the end of the meeting. Any old business or new business? We will, I'm going once, going twice, about to adjourn the meeting. Then I will adjourn the meeting and wish everybody a good weekend and a good afternoon, and stay safe.
Thank you.
Thank you, everyone. And a special thanks to those of you who bravely came into the building and became our quorum. So I greatly appreciate that. So,
Thank you, everybody.
so take care, team.